But the pandemic is not over. Worldwide, more than 100 million cases of COVID-19 have been recorded. There have been more than 2 million deaths. We now have mutant strains that have been identified from the United Kingdom, South Africa, and Brazil. And there are many growing concerns about the mutant strains of the virus. At this time, we are not conducting genomic surveillance or gene sequencing of the coronavirus on site. However, health officials are closely monitoring viral patterns that we are seeing, especially among travel-related or imported cases of COVID-19. As these new strains emerge, strains of the COVID-19 virus replicate more and in turn cause more disease and death. Therefore, we must continue heightened surveillance, which is test, isolate, and treat. We must continue to practice 6 feet from others. Wash your hands thoroughly and frequently. Avoid large gatherings. Stay at home if you feel unwell. These practices have contributed to is another way that we can protect ourselves and others from COVID-19 and also from the new strains. It is a known fact that vaccines save millions of lives each year. They work by preparing the body's immune system to recognize and fight off viruses. Concerning the vaccine, the government of the Bahamas will only accept stringent regulatory authorities. We know the benefit of vaccines. We have vaccines. Reports suggest that the virus is sensitive to the vaccines that have received WHO pre-qualification and emergency use authorization. To date, 3 COVID vaccines have received authorizations for emergency use: Pfizer, BioNTech, Moderna, and AstraZeneca, Oxford. Now, emergency use authorization provides a pathway to fast-track products intended for use during a public health emergency. Emergency use is only authorized for the duration of the declaration of the emergency. Vaccines approved for the Bahamas must be certified through the pre-qualification process and must have emergency use listing. That's the term used in the EU and UK. EUA, or the authorization, emergency authorization provided by the FDA, or some other stringent regulatory authority as approved by the Caribbean regulatory system. In the Bahamas, the Ministry of Health serves as the regulatory authority for assessment and importation of vaccines at the national level. A team reviews all vaccine offers and makes recommendations to the Consultative Committee. Vaccines must come directly from the manufacturer with accompanying scientific materials. The pre-qualification process includes monitoring of the vaccine manufacturing practices, and an expert scientific group reviews the application as part of determining whether the vaccine is safe for use. Following the pre-qualification, vaccine manufacturers must supply to an internationally recognized authority, such as the FDA or the MHRA, the Medicines and Healthcare Products Regulatory Agency in the UK, for this EUA or emergency use authorization. The emergency use pathway in no way compromises the safety and certification process for the development of the vaccine. The COVID vaccine is not here yet, but as announced earlier this week, the Bahamas has been formally notified that it could receive 100,000 doses of the AstraZeneca Oxford vaccine starting the second half of February through the second quarter of 2021, and this would come through the COVAX facility. The government also continues to work on all fronts to secure additional doses of secured vaccines, secured and approved. The Bahamas has the capacity to store the expected 100,000 doses of AstraZeneca vaccine at the appropriate in the private sector. The AstraZeneca vaccine is a viral vector vaccine and is administered in 2 doses. What does this mean? A viral vector vaccine means that the virus has been genetically the unprecedented number of financial and operational resources that were put behind the development of the COVID-19 vaccine, which was testing that included testing in representative populations. The research is ongoing. The AstraZeneca vaccine has been tested in 18 to 65-year-olds. However, today, February the 4th, the European Medicines Agency has authorized COVID-19 vaccine AstraZeneca in people from 18 years onward, including those 65 and above. More data are continually becoming available for this older age group. In the Bahamas, our population chart, please, it is estimated that you see the distribution by age. It is estimated that 65 and older make up 7.4% of our population. I will pause here and indicate to you that we had a high-spirited debate as to what would be the recommendation this morning before we got the news, the additional news on the 65 and 18 to 65 immunization program for COVID-19. You would hear more about that. The distribution and administration of the COVID-19 vaccine in the Bahamas will be a great operational challenge, and perhaps the most difficult that the public sector has ever faced. In the Bahamas, we have demonstrated a strategy to eliminate congenital rubella using a mass immunization campaign. This was in 1998. And we are fortunate that persons who worked on that team are now assisting with the rollout of the COVID-19 vaccine. The distribution plan is in is in the process of being finalized. It is anticipated that all aspects of the plan will be tested before going live to ensure the safe and effective distribution of the vaccine. Training modules are in development to cover vaccine pre-registration, training of vaccinators, electronic documentation, data management, for monitoring of adverse events, and also the management of medical waste. The vaccines will be administered at accessible locations in communities throughout the Bahamas to increase access to all Bahamians and residents and ensure equitable distribution of vaccines to those who choose to take it. There will be a focus on high-risk populations where COVID-19 has occurred, as indicated in the previous map. 3 priority groups have been proposed. Group 1 will consist of healthcare workers, uniformed branches, and elder care providers. Group 2 include persons with disabilities, persons living in congregate settings, critical workers in high-risk settings, other essential service workers, persons with comorbidities and underlying conditions, as well as sea, air, and ground personnel. Group 3 will include all others not previously identified in groups 1 and 2 and who are eligible. All approved. We will make, I would like to repeat, that special provisions would also be made for those with disabilities. All approved vaccine sites must be accessible, safe, and appropriate for the distribution of the vaccine. In addition to public health providers, there is a proposal to engage private practitioners to help administer the COVID-19 vaccine. There will be 4 steps to complete the vaccination process: registration, vaccination, monitoring of adverse events, and then there is certification. Pre-registration for the vaccine will be available online and at registration centers across the Bahamas once these sites have been finalized. The rollout of the vaccine will be carried out in 3 phases. It is anticipated that the rollout would be conducted over a 6-week period. The proposed sequence is as follows: 1 to 4, New Providence, Grand Bahama, and Bimini; 2 to 5, Abaco, the Abo Keys, and Exuma; 4 to 6, Andros, the Berry Islands, and Eleuthera; and the remainder of the family islands will be covered during this period. At the outset, healthcare workers at public health facilities, vaccinators, and frontline workers will be targeted early in the administration process. On islands with small populations, health teams will immunize all eligible residents. They would not follow the priority groups. These islands will, as I said, will not follow the priority group listings. There's small populations. And local teams will be supported by mobile teams from New Providence. We are also working with a wide network of Rotary clubs, with Alive and other corporate sponsors and groups. Islands would be prioritized based on the profiles of case distribution and transmission of infections. I think we can show the progress that has been made with days since the last confirmed case by island. And I think this is really a very beautiful slide. Vaccines will be transported by air to the family islands in portable coolers. It is anticipated that anyone receiving a vaccine, I'd say completing the vaccine process, will receive a COVID-19 vaccination certificate. In the case of a 2-dose vaccine, certificates will be received following the 2nd dose. The presentation of the certificate may be associated with travel in the future. This is a potential requirement that continues to be discussed by many countries and international partners. We want to protect as many people as we can. However, we must recognize that there are those who should not get the vaccine. This is based on what we are learning from the published literature about the vaccine and the administration of more than 100 million doses worldwide. Extra precautions must be taken to determine if there are significant allergies or if the immune system is compromised to the point that significantly reduces the effect of the vaccine. This is the reason why we must protect those who cannot receive the vaccine. Getting the vaccine protects not only you, but those around you. COVID-19 vaccines will be available free of charge to eligible adults and will not be mandatory. The vaccine has not yet been approved for use in children. However, more data are expected to be available in the spring. The Ministry of Health and the Consultative Committee will continue to provide regular updates and information on COVID-19 and the vaccine, including our efforts to deliver a safe and effective vaccine to you. The public is encouraged to use the Ministry of Health and Office of the Prime Minister's social media platforms and websites and credible news and information sources to keep up to date and be properly informed on the COVID-19 vaccine. A national vaccination public education program will soon be officially launched by the Ministry of Health. In support of the program, information will also be available at www.opm.gov.bs/COVID-19 vaccines. Thank you very much. We will now take questions from the media and answer questions from the public. Benita Swain, sorry.
Good afternoon, Dr. Regis. Good afternoon, Mohammed. You spoke about in your presentation viral patterns. Can you provide a bit more information on what local officials have discovered so far in regard to this?
To viral, sorry?
Viral patterns you mentioned
Part,
earlier when you were
part,
patterns, yes, in terms of the mutations of the virus.
oh, we don't see them as partners.
I
Uh,
said
patterns, oh,
yes,
patterns.
patterns.
We have
Yes,
not
not
gotten
partners.
any results from our outsourcing of genomic sequencing. Uh, and we are looking at viral loads, but our case load is so small. So that really limits any meaningful analysis on our viral loads. But we're looking and monitoring to see if there are any spikes or clusters related to travel, the travel cases or imported cases. But our caseloads are just so small. Okay, thank you. There's a question that comes from Ida Wanda Dorset. Can you explain how many doses have been received and the number of persons who will receive both doses? Um, do you wish me to answer that, or you will answer it? As indicated at this time, we have a commitment of 100,000 cases, sorry, doses. So the persons, based on the science that we have to date, or we had this morning, it was decided that we would make an interim recommendation for following the science of a 2-dose regimen, and given our very low case load. So that amounts to 50,000 persons. Kyle Walking, please, our news.
Hi, good afternoon, Dr. Don Regis. You mentioned in your presentation that proof of vaccination is something that may be required for travel in the very near future. Is this something your committee or health professionals are recommending to the Bahamas government for travel to the Bahamas?
No, we're not. However, we have noted that the cruise industry has already made a requirement for vaccine for cruise to book for cruises. There's another question that comes from Shannon Pinder. I'm a resident of Nassau. I have a resident spouse permit as I am married to a Bahamian. I understand that you are expecting to receive 100,000 doses of AstraZeneca vaccine soon. Are residents eligible to receive the vaccine? The answer is yes. We go to Sancheska Brown.
Have been the vaccine that the committee would have chosen? And if so, why or why not?
Do you mind repeating? You were muffled the first part of the question. But if I'm understanding, would the committee have chosen AstraZeneca
Yes,
over the others?
Over the other, yes.
Over the other two that are the options? Is that the question?
Yes, I was wondering
yeah.
if AstraZeneca would have been the vaccine that the committee would have chosen.
The answer is yes. We were quite amenable to receiving Moderna, but because of the ultra cold requirements of Pfizer, we recognized that that would have been a challenge for portability, particularly throughout the archipelago. Okay, Grand Bahama Melinda Riguer asks, why will only 10% of the population be vaccinated? That is indeed not the case, but I would invite Dr. McMillan. Do you care to speak to that?
Good afternoon, Bahamas. As Dr. Dalregis would have suggested, 10% of the population would not be the total amount that will be vaccinated. We will begin vaccinating along the priority groups that were mentioned, and certainly as we get additional access to vaccines, we anticipate that we will vaccinate up to about 80% of our population. We would wish to have herd immunity, and certainly other vaccines would have. Generally, we try for 80% of the population. We take into consideration other measures, but 80% of the population is generally what we seek to have vaccinated. So we will be moving beyond 10%.
Ms. Rigger, you had part of your question, I think, was 20%, where did the 20% come from? And that was just the prepayment. That had nothing to do with the projections or what is planned in terms of our immunization schedule. Can I now go to Elizabeth Bryan, please? The Eleuthera News.
Good afternoon, Dr. Dalregis. All right, what will this initial vaccine rollout look like specifically on the island of Eleuthera in terms of logistics? For example, with its 10 plus clinics, who will the priority recipients be on the island? And do you have an idea of the number of vaccines to be made available to Eleuthera in this first batch?
The second part is easy. We have not calculated the distribution of the 100,000 doses, and we are just setting the plan. Now, the plan for Eleuthera, as you see in the phases, we looked at the numbers, and we may be able to do the all groups and not limit ourselves to be starting with priority groups. If we field enough vaccinators and trained health personnel, I think, Ms. Bryan, we'd be able to all the eligible persons on Eleuthera, we'd attempt to do that in one sweep. There's another question that comes: what is the time limit for the second dose to be administered? Dr. Archer?
Good afternoon, Bahamas, and thank you for your question. Based on the literature that I've read, the second dose, you have approximately a 12-week interval. Thank you.
Okay. Tyler Simonet, please.
Yes, good afternoon to health officials and good afternoon to the Bahamas. I want to know, are health officials concerned about the number of people who are saying that they do not want to take the vaccine? As we know, herd immunity can only be achieved if a large number of people take the vaccine. So what's the ministry's plan for that scenario if that were to happen?
That's an excellent question, because we do have a plan for that. We have a very aggressive communications plan, and I'd invite Mr. Fields, if you'd speak to that, please.
Thank you, Dr. Dalregis. Obviously, the vaccination is voluntary, and so it is incumbent upon the Ministry of Health, the Consultative Committee, to provide as much information that would arm, no pun intended, arm recipients of the vaccine with the information they need to make their own personal decision. And so over the next 2 to 3 weeks, you will find that a very extensive communications plan will be launched, and I think it'll allow our citizens to make decisions that are based on that information. Thank you.
Okay. Samarco Lightburn, please, from The Blaze.
Good evening, Dr. Dal Regis. You mentioned that vaccines will be transported by coolers to the Family Islands when the rollout begins. What kind of additional infrastructure will be needed to house the vaccine? And is their effectiveness linked to being kept at an ideal temperature?
Gotcha.
Good afternoon once again. Yes, the vaccines will be transported via coolers. The coolers are able to maintain the appropriate temperature for approximately 5 days. I think that answered your question.
And what infrastructure?
Oh, I'm sorry. In terms of the infrastructure, we do have refrigerated units on all of the Family Islands dedicated only to vaccines. So these refrigerated units would be what we would use to house the vaccines once they arrive on the relevant island. Thank you.
Another question comes, if you've already contracted COVID-19, do you need to be vaccinated? And the answer is yes. Royston Jones, please.
Good afternoon, Dr. Dal Regis, and good afternoon, everyone. In the rare cases of severe side effect, or if something goes wrong with taking the vaccine, such as death associated with the vaccine, though I believe it has immense benefit, and of course I will be taking it, where does the liability fall, and how does the government approach this? I know that in the US, I believe that immunity has been granted from liability, but how do we approach that?
Again, an excellent question. The first part, they have not recorded any deaths associated with the vaccine. That's 100 million cases. Right now it's 105 million. They have not recorded any deaths, no hospitalization and ICU admissions following 105 million doses administered of COVID-19 vaccine that has met EUA standards. In terms of the liability issues, this is a challenge in that the Bahamas government is asked to provide indemnity or coverage for this vaccine. And at this time, we don't have a final determination of it. And I think we have a few more weeks before the vaccine comes. So hopefully we'll be able to answer that question for you more directly. Rashad, Mr. Rashad Roll.
Yes, good day.
Good day.
Can you clarify whether the 100 doses will all come at once or whether they will come in batches? And how are you going to limit administration errors and keep track of who has received the first and second doses of the vaccine, considering a lot of people aren't familiar with the process being paperless?
Always a good question. Mr. Ed Fields will answer that.
One of the things that we are heavily engaged with is the data management of the vaccine, in addition to, of course, recording of adverse effects. And so, if I remember your question correctly, there's going to be, we're going to be recording all of this stuff. We are making sure that all batch numbers are recorded. And I think that what we're going to do is to assist people where we can with registration, when they can't register themselves. And I think that you're going to find that this is going to be a relatively seamless process, because we're putting exhaustive amount of time in making sure that everything is done efficiently, electronically, and without a bunch of paper. I hope that answers your question. Okay.
I am told that there is an opportunity for a second round if anyone is interested. I don't, this is after we've invited Karen Bain to ask her question.
Good afternoon, Dr. Del Regis. Good afternoon, Bahamas. Karen Ferguson Bain, Global 99.5 FM. Based on the information received to the medical professionals, can you tell us if asymptomatic persons who receive the vaccine shot, are they capable of passing on the COVID-19 virus to others?
Based on the literature, the answer is yes. If they have the virus, the vaccine prevents them from getting the disease. We're now learning with the AstraZeneca that it slows the transmission of the viral infection, which is very good news. But we don't have that data from any other group. So we are really optimistic that this is not likely to occur. And again, if we are able to maintain our low transmission at the community level, it would really prevent more infections from occurring. Do you have a follow-up question? Because I'm going to offer a second round of questions, and I'll go from the bottom up. No?
Yes, ma'am, I do. Thank you so very much, and thank you for your response. How effective will the AstraZeneca vaccine be against this new strain of the COVID-19 virus?
Still being investigated, madam.
Okay.
Number 7, please. Royston Jones. Well, what about Rashad? He's gone? Sorry. Okay, sorry. Do you have a second question, Mr. Jones?
Yes, I do. Thank you. If you can hear me okay.
I can.
Excellent. My second question concerns, well, a bit of a two-part if I can sneak it in. If the distribution plan has not been finalized as yet, what might be the timeline in terms of actually starting to vaccinate the first few individuals if we're going to get the vaccine mid this month through the next few months? When can we actually start seeing vaccinations distributed? And the second question would be, if we have multiple vaccines available in the oncoming months, will the public have the ability to choose which vaccine they take? If it's AstraZeneca and let's say we get Moderna or Pfizer or JJ, can I say, well, I want this one or that one?
Unlikely. Why? Because we really have to stick to our target groups. And we're really hoping, against hope, that we would be able to have the single dose choice. And if we have the single dose choice, it would really change our distribution plan in terms of the rollout. You asked when can we expect to complete our plan. We're going to complete the plan in 2 weeks on paper, but we have to test it. And we want to be sure that we test it properly, and so that when we're able to roll out, we do it in the design that we want to do it, and do it quickly. Oh, he's back. He missed his turn. Oh, they tell me I must go back to Rashad Roll.
Yeah, I want to know, can you verify whether the 100 doses will come all at once or whether they will come in batches?
Yes, sorry, you had asked that question before. I'm terribly sorry. We didn't answer it quite. We are hoping that there is, if they, we don't know. We don't know. But we are expecting that it may come in two tranches. But those tranches would be close together. We will know more in a week's time, they tell us. But we are just in a holding pattern right now. And you're fully aware, Mr. Roll, what the competition is like to get these vaccines. Number 6, please. Samarco Libran. I'm getting some coaching here.
Hi, Dr. Dalregis. Thank you for the second round. My question pertains to data regarding subgroups and the vaccine's efficacy. France is saying that they won't use the AstraZeneca vaccine on persons over 65 years of age. How much data is the ministry working on regarding various subgroups that prove it's safe for all?
Okay. We have a choice, and we are, at this time, prior to this afternoon's release of additional data, we had decided that we would vaccinate 18 to 65-year-olds, and the older than 65, that's 28,000, such a small population, that we would hold on that group. Given the new literature, we would have to review that data, and we really need to, rather than rely on press releases of scientific data, to have an opportunity to look at some of the published data that has gone under peer review. So a group of scientists, including our national representatives, will have active discussions on this, and then such recommendations will be taken to the committee, and they will decide. But we have, the plan is, from this morning's plan, was to limit our grouping to 18 to 65. Oh, I'm number 5 now. Tyler Simonet.
Hello again. Thank you for the second round of questions. Oh, I just wanted to ask, what are health officials' concerns in regards to the vaccine's efficacy against the COVID-19 variants, especially since we're unable to test for the new variant in country?
I tried to share with you that, what is out there in the scientific literature pertains to investigations where you have a lot of disease and you have an opportunity to make an informed assessment or analysis of the data. In the Bahamas, we don't have such large numbers. And that's a good thing, although it's a limiting thing in terms of the response to the variants. We can quote to you what the literature says, that AstraZeneca does have some protection against mutant strains. And as you are aware, these strains are changing on us and moving among us and spreading much more readily than the original COVID-19 virus behavior. And as a result, we're really concerned that we don't import these mutant strains into the Bahamas. Elizabeth Bryan, please. Sorry? Saneshka Brown. So we're not going to do Elizabeth? Okay, sure, fine. Miss Saneshka Brown, please. Kyle Walking. Jemanita Swain.
Good afternoon again. My second question, Dr. Dalregis, you mentioned in your presentation, or we've heard on numerous occasions, that the vaccine is not mandatory, it's voluntary for persons wishing to take it. My question is whether or not public officials, for instance, members of parliament or persons like that, will this vaccine be mandatory? Are you able to say would it be mandatory for those persons?
They have expressed a wish to be in the first group, but we must prioritize. Okay, well, thank you, and have a good afternoon. That concludes our press conference.